Hi, thank you for joining our Facebook Live today. My name is Carrie. I'm with Unity Point Health. Today I'm at our Westmark Outpatient Therapy Services. I'm here with Molly, who's a pediatric speech therapist, who's going to talk to us a little bit about a new service we have called
Right.
Prompt.
Yeah.
So, Molly, tell me a little bit about what Prompt is.
Okay. Yeah. So Prompt stands for Prompts for Restructuring Oral Motor Phonetic Targets, which is basically a fancy way of saying it's a hands-on approach that we use with kids to really kind of guide their mouths through producing different speech sounds.
Okay.
So it's really effective for a variety of populations, and it's been a really nice addition to our treatment team here. So
Great.
yeah.
Well, that's exciting.
Yeah.
How does it differ from some of the other therapies or treatments you might do for kids and improving speech?
Right. So most of what we do as speech therapists is really more visual and auditory prompting. And so what Prompt provides is a different way to really get hands-on and actually manipulate their oral structures to help them to learn how to produce these sounds that really would not be possible without that hands-on approach.
Okay.
So yeah.
So maybe from a traditional standpoint, you're looking at maybe an image of a cat and you're encouraging them to say the word and you're helping them sound things out. That would be maybe a more traditional approach.
Sure. Or even just like look at my mouth, watch what I do, listen to how I say it versus actually like me showing their mouth with my hands how to produce the word.
Do you want to try that?
Sure.
Maybe do a demonstration
real
quick?
Yeah.
Okay.
So a good example would be like the word you.
Okay.
So you support the back of their head just to keep them in the right like neutral position. And then we would start with you. So I'm actually showing their lips and their mouth how to move. Yeah.
Let's try another word.
Okay, so another good example would be me.
Okay.
So me. Mm-hmm.
Interesting.
Yeah.
So really you can help train their lips and their mouth to do the right shape.
And you really use not only touch but pressure and timing and placement to really teach them all the components of the speech sound. So not just how to move, but like the voicing part of it and how long to hold the sound and just different things like that.
So as you learned this, were you going through the alphabet, like kind of learning what movements and how, like what pressures?
Yeah, literally there's a prompt for each phoneme in the English language, every consonant and every vowel sound. So
cool.
Yeah, it's pretty neat.
Not a sign language, but in some ways it's using your hands to teach speech.
Yeah, exactly.
Wow.
Yeah.
Well, that's really cool.
Yeah.
So what kind of kids would this best be used for? What kind of
So when most people think of prompt, because it's a motor speech technique, you think of using it with motor speech disorders like apraxia as an example or dysarthria, but actually it can be really effective with individuals with autism, which is who it was originally developed for. And then you can use it anywhere from like children who are completely nonverbal to teach them how to use their voice to communicate, all the way up to someone who's very verbal and kind of cleaning up their speech sounds to make them more clear and understood by listeners. So
awesome.
Yeah.
So when a kiddo comes in for their treatment session, is this like the one thing that you do? Is it coupled with some of those traditional techniques, or how does that work?
It kind of depends. For some it is just solely like a prompt session, and for others it's just kind of a technique I incorporate along with a lot of other things. So yeah.
And how long does that usually last as a session? Is it?
Yeah, usually we do either between 45 and 60-minute treatments here, which is actually what's recommended by Prompt is one time a week for a 60-minute session, which is kind of different from other approaches where they recommend like a really intense frequency, like 2 or 3 times a week. Prompt has found through their research that really just even one time a week for an hour can be really effective to promote that progress. So.
Well, and I think it would probably make sense that you're practicing that muscle for so long that kind of sticks with you then. So
yeah, exactly. Yeah.
Awesome. If someone wants to get an appointment for prompt therapy, what does that process look like?
Yeah, so basically they would just need to talk to their physician and just ask them to send an order over to our clinic here at Westmark Outpatient Therapy. and then our front desk staff would contact them to set up an appointment.
Well,
So,
that's easy enough.
yeah.
Is there anything we're forgetting or that you really think our listeners should know today?
I don't think so. I feel pretty passionate that prompt is it's an amazing thing. It's really changed the way that I practice, and it's helped me to not only listen to the way that my kids are speaking, but also to look at their mouths and really observe how they're moving. And it's very effective, and I'm excited about it. So,
well, good.
Yeah.
We're so excited that you have this certification and that we're able to provide this service to the members of our community. So
yeah, definitely.
This is great news. If you would like to learn more, like Molly said, contact your physician. If you just have some general questions about prompt therapy, feel free to give our team at Westmark a call. The number is 563-557-9955. You can also learn more at unitypoint.org/Dubuque. Thank you for joining us today. And Molly, thank you so much.
Thanks.